But it's quite interesting that we have a global trend going up of substance misuse. Now, we also know why people get into a misuse or an overuse situation. We know the factors that affect that. Now, not one of those factors, but multiple of those factors, those risk factors, can lead us into a misuse environment. There's a very big debate going on about inequality. And this has come about since, the global financial crisis. We were pretty well equal in Australia in terms of equity was quite narrow. And a man named Richard Wilkinson wrote a book called The Spirit Level. And it's all about those countries that have a wider gap between the rich and the poor actually have greater health issues and have greater problems in their society. Those that have a narrow gap actually have less. The global burden of disease looks at things like death, mortality, and those sorts of things. There are now a few people who are saying we should change the way we look at the world burden of disease in terms of no longer about deaths, but about disability. And what they're seeing is, because infant mortality was very high in the world, what they're seeing now is a rise of non-communicable diseases like back pain and mental health problems. Doesn't that tie in? Do you hear the same thing repeating over again? Stress, anxiety, mental health, back pains, insomnia, all these things keep repeating.
But particularly because the principle of Streetwise and the work that I was doing before is a belief that communities and people have got the wisdom to solve their own problems. The difficulty is we look to other people who are in more of authority roles to solve them. And one of the challenges we find is that we get caught in this cycle of complaint. And it's a bit of a paradox, because you may be in a position where people are looking to you for leadership, but also we love to complain about it. We love this big whinge around how bad leadership is. And again, that speaks to this fantasy that there is anybody else out there but us who can actually solve our problems. So we get caught in this. I get caught into this myself, over a few glasses of wine. It's really nice to have a good whinge about them all. But what am I doing about it? And what can I do? And what does leadership look like for me? Is that leadership is about how do we help people solve their own problems, tap into the wisdom that is already there and get things done. Not a kind of what I'd call counterfeit leadership, which is what we see playing out on our TV screens most days. Because often we seek out people who see the world the way we do. And it's only by me working with people who have a completely different idea of the world that I'm going to learn. It might challenge me, I might find it really difficult, but that's really where the gold lies in collaboration. When we can bring together people who have very different views of the issue and find a way to work together.
And whilst we have much to be crowing about, the fragmentation of community represented in the homeless, in Indigenous suffering, in people with poor literacy, people with mental health issues, the growing number suffering from drug and alcohol problems, and particularly, it's a striking figure, the way overrepresented number of Australians now in the Australian prison population. America's the outlier. The Northern Territory incarceration rates are higher than America. Australia overall has more in prison, twice the number of any Western European nation, 4 times the number of Ireland. Sort of ironic. A few boats with Irish convicts landed here in 1788. And we're now going back to being the convict nation, and Ireland isn't. The chemistry of happiness has always been about making people feel better rather than making them feel well. Pain is not the worst thing. I asked him what he meant by that. He said, well, actually, facing pain is where character comes from. It's where you grow. If you can't face pain and go through it and share the pain, what community is is really sharing pain, sharing stories, knowing that you matter enough for others to actually journey with you. They can't take the pain, but they can share the pain. Well, we're a culture that doesn't want to face pain ever. And it's a culture that finds still the analgesics as the way. And then when people, surprise, surprise, get addicted, we scapegoat them. I say to young people, finding a purpose, I think, is finding this intersection where your bliss intersects with the world's need, where your happiness intersects with the world's need. It might be your art, your music, your drama, your writing. It might be your relationships and volunteering, where your bliss intersects with the world's need. Purpose is finding that centre and sharing it. At the end of the day, that purpose is about community. The self is too brittle to be a site of meaning.